You stand up from a chair. Everything feels normal. Then, in a single second, a sharp pain shoots from your hip into your leg. It does not stay in one place. It travels through the buttock, races down the thigh, and may continue all the way into the foot. But here is the strange part. The place where you feel the pain may not be where the problem actually begins. You may rub your hip, press your thigh, or stretch your leg. Meanwhile, the real source may be hiding much higher, between the lowest bones of your spine. It is like a flickering light caused by a damaged wire hidden inside a wall. Your leg is where the warning appears. But the disturbance may begin somewhere else. So, is the pain physically moving through your leg? Or is your brain receiving a signal and assigning it to the wrong address? Why can a tiny structure near the spine make an entire leg burn, tingle, ache, or feel weak? And most importantly, when is this simply an irritated nerve, and when is your body sounding an emergency alarm? We are about to follow this signal from the leg all the way back to the spine. If you enjoy seeing the human body taken apart like a living machine, subscribe now, because the signals your body sends are often far stranger than they seem. Before we continue, one thing must be clear. Pain traveling from the hip into the leg does not automatically mean sciatica. This video cannot diagnose a specific person. If the pain begins after a serious accident or comes with fever, rapidly increasing weakness, numbness around the groin or anus, difficulty starting urination, inability to urinate, or loss of bladder or bowel control, seek urgent medical care. Those symptoms may signal severe pressure on the nerves that control the legs, bladder, and bowel. For most people, the first instinct is simple. Pain near the hip must be muscle pain. That sounds reasonable. The gluteal muscles can tighten. The hip joint can become irritated. Tendons and ligaments can hurt. But pain that feels sharp, burning, electric, or shooting along a long path down the leg suggests that the nervous system may be involved. Muscle pain often feels more like a sore, bruised, or tight area. It is usually easier to locate. Nerve-related pain can feel more like a message traveling along a cable. You do not feel only one painful point. You feel the route. But sensation alone cannot confirm the cause. Different problems can produce very similar symptoms. Describe the pain with one number. If it feels like an electric shock, type 1. If it feels more like a dull ache, type 2. This is not a diagnosis. It simply shows how many different experiences can hide behind the single word pain. Another common assumption is that pain near the hip must come from the hip joint. But the body does not work like a simple map where every painful location matches one damaged part. The brain must interpret signals arriving from millions of nerve endings. Sometimes a signal starts in the lower back, but is felt in the buttock, thigh, or foot. This can happen because nerves from different areas share connected pathways. Imagine the brain as an operator in a huge communication center. Every nerve is a phone line. When a nerve root becomes compressed or irritated, noisy signals enter the system through a line that normally carries information from the leg. The brain then creates pain in the region served by that line. The pain is not literally crawling down the leg. What is traveling is electrical and chemical activity inside the nervous system. That is why rubbing the painful area sometimes does not solve the problem. It is like drawing water from the floor without checking the leaking pipe inside the wall. But this does not mean that every shooting pain is caused by a herniated disc. Narrowing around the spinal nerves, inflammation, joint changes, muscle problems, and several other conditions can create similar symptoms. Now let us open the machine. The spine is not one solid column of bone. It is more like a tower made from separate blocks stacked on top of one another. Between those blocks are flexible discs. Behind them is a protected passage containing important nerve structures. Nerve roots leave the spine through small openings on each side. They then join larger networks that travel into the pelvis and down the legs. Each spinal disc can be imagined as a tough cushion with a softer center. Its job is to spread force when you walk, run, bend, twist, or jump. Over time, or after certain injuries, the softer material can push against the outer layer. The disc may bulge or herniate. If it takes up space near a nerve root, that nerve can become irritated. The result may be pain, tingling, numbness, or weakness traveling into the leg. But compression is only half the story. A nerve is not simply a wire being squeezed. The tissues around it can release inflammatory chemicals. These chemicals make the nerve more sensitive. Think of a smoke detector that has been adjusted to maximum sensitivity. A tiny amount of smoke now triggers a loud alarm. In the same way, a sensitized nerve may produce a strong pain signal from a relatively small irritation. That is why the size of a disc problem on a scan does not always match the intensity of the pain. A dramatic-looking scan may cause few symptoms. A smaller change may cause severe pain. The phrase sciatic nerve makes many people imagine one single cord beginning at the hip. In reality, the sciatic nerve is formed from several nerve roots that leave the lower spine and sacrum. These roots join together like several lanes merging into one major highway. The resulting nerve passes through the buttock and continues down the leg. Sciatica is not the name of one specific disease. It is a pattern of symptoms involving this nerve network. Different nerve roots contribute to feeling and movement in different parts of the leg. That is why the exact location of pain, tingling, numbness, or weakness may give a clinician clues about which pathway is affected. One person may feel symptoms along the outer thigh. Another may feel them behind the calf. Another may feel them near the foot or toes. But these maps are not identical in every person. They overlap. So looking at a diagram online is not enough to identify the exact nerve involved. Does your pain stop in the thigh, or does it travel below the knee? If it stops in the thigh, type 1. If it reaches the lower leg or foot, type 2. Again, this is only a description of the pattern. It is not a medical test. A nerve works more like a data cable than a rope. It carries sensory information toward the brain. It also carries movement commands from the nervous system to the muscles. When a nerve root is irritated, pain may not be the only symptom. You may also feel pins and needles. A patch of skin may feel numb. Touch may feel strangely different. If the motor signals are affected, certain muscles may become weaker. That is why a clinician does not only ask how much something hurts. They may also examine strength, reflexes, sensation, walking, and balance. During an evaluation, a healthcare professional may ask you to move the leg in specific ways. They may test whether you can control the foot normally. They may check reflexes and compare sensation in different areas. They will ask when the pain began, what makes it worse, what makes it better, and whether other symptoms appeared at the same time. It is like checking the power source, the cable, and the machine at the other end instead of staring only at the warning light. A herniated disc is not the only possible cause. The spaces inside the spine can become narrower. The small openings where nerve roots leave the spine can also lose space. Bone and joint changes may contribute to this narrowing. In some people, one vertebra shifts slightly in relation to the bone below it. All of these changes can reduce the room available for a nerve. And there is another layer of complexity. Pain in the hip and leg may begin outside the spine. The hip joint can cause pain. Muscles and tendons can cause pain. Peripheral nerves farther down the body can become compressed. Circulation problems can also create leg symptoms. For example, a sensory nerve serving the outer thigh may become trapped and cause burning or numbness in that region. That is not the same mechanism as classic sciatica. The correct name depends on the real source. We have now seen that pain can be the visible surface of a very complex system. Subscribe at this point because the next part is where the system reaches its limit. What happens when the signal does more than create pain? What happens when function begins to disappear? Pain is often the loudest warning, but it is not always the most important one. Imagine a control cable connected to a machine. When the cable develops mild interference, the system produces noise. When the signal becomes weaker, the machine begins to respond slowly or incorrectly. In the body, this may appear as leg weakness, difficulty lifting the foot, reduced control, or a change in walking. New weakness or weakness that is getting worse needs medical attention. This becomes even more important when both legs are affected. At the bottom of the spinal canal is a group of nerve roots. They spread out in a shape that resembles a horse's tail. These nerves help control sensation and movement in the legs. They are also connected to bladder, bowel, and pelvic function. If this group of nerves becomes severely compressed, a rare but serious condition can develop. This is known as cauda equina syndrome. It is a medical emergency. Warning signs can include severe or worsening weakness in both legs, numbness around the genitals, anus, inner thighs, or the area that would touch a saddle. They can also include difficulty starting urination, inability to urinate, loss of normal bladder sensation, or loss of bladder or bowel control. If these symptoms appear, do not wait for them to improve. Do not try to fix them with stretching, massage, or online exercises. Seek emergency medical care. How did your pain begin? If it appeared suddenly, type 1. If it gradually increased over time, type 2. The way a symptom begins is useful information when speaking with a healthcare professional. But urgency depends on the full group of symptoms, not only the speed of onset. Fear often makes people want to remain completely still. But for many cases of uncomplicated nerve-related leg pain, the best approach is not total bed rest. Treatment depends on the cause, severity, age, medical history, and other symptoms. It may involve appropriate movement, physical therapy, pain management, and monitoring. There is no single stretch, exercise, or medication that is right for everyone. A movement that helps one condition may irritate another. That is why aggressively copying exercises from a random video can be a mistake. Young people should also avoid taking medication without guidance from a parent, guardian, pharmacist, or healthcare professional. The good news is that many cases of sciatica improve with time. When a disc herniation is involved, inflammation may settle. The disc material may shrink. The nerve may become less sensitive. Movement and function may gradually return. Surgery is not required in every case. But improvement is not a reason to ignore severe, persistent, or worsening symptoms. The pattern matters. The neurological signs matter. The cause matters. Medical imaging can be useful, but an image does not tell the entire story. A scan may show a bulging disc in someone who feels no pain at all. It may also show several changes, while only one is connected to the symptoms. Think of a scratch on the outside of a car. The scratch is visible, but it does not prove that the engine is failing. In the same way, an abnormality on a spinal scan is not automatically the cause of every symptom. The image must match the history and the physical examination. That is why not everyone with leg pain needs immediate imaging. A clinician decides based on the severity, duration, neurological findings, warning signs, and suspected cause. Even without emergency symptoms, medical evaluation may still be appropriate. Seek help when the pain is severe, keeps getting worse, limits normal activities, comes with numbness or weakness, or fails to improve. Pain after a major injury also needs attention. Pain with fever, unexplained illness, or other unusual symptoms should not be dismissed. The goal is not to guess the name of the condition as quickly as possible. The goal is to identify what system is producing the signal and rule out anything dangerous. And now we reach the strangest twist. Pain is not a physical object sitting inside the leg. It is an experience created by the nervous system to protect you. Signals may begin in tissues and nerves, but the brain combines them with movement, attention, memory, expectation, and context. Then it creates the final experience we call pain. That does not mean the pain is imaginary. It means pain is the real output of a living warning system. A system that can become more sensitive. A system that can calm down. A system that constantly updates its judgment about danger. Pain is like an alert on a digital map. It tells you there may be a problem somewhere in the network. But the location of the alert is not always the location of the source. The hip may be where the alarm seems loudest. The leg may be where the signal is felt. But the disturbance may begin in a tiny space near the spine. Understanding this changes the question completely. Instead of asking, "How do I stop the pain in my leg?" we begin asking, "Where did this signal begin, and why is the nervous system producing it?" The same network that can create pain also allows you to feel the ground. It helps you balance. It tells your muscles when to contract. It allows you to walk without consciously calculating every movement. The back, hip, leg, and brain are not separate machines. They are parts of one information system. You are not simply a skeleton covered in muscle. You are a living communication network that can sense, predict, react, and protect itself. If this video changed the way you think about pain, subscribe to the channel. Understanding the signals of the body can help you recognize when to stay calm, when to seek advice, and when a warning should never be ignored. The next time pain shoots from your hip into your leg, remember this. The place where the story is felt may not be where the story begins. But when your leg becomes numb after sitting too long, is the problem really happening inside the leg? Or is the nervous system misleading you again?